Many people ask about a Whipple operation. Dr. Whipple was a surgeon back in the 1910s, 1920s, 1930s in Rochester, New York. Whipple is how you spell it. The Whipple operation is typically for somebody that has a mass in the head of the pancreas or the duodenum, which means something in this region here. So this would be the stomach. This is the liver. This is the gallbladder. Spleen. And this is what's called the duodenum, the first part of the small bowel. The pancreas is located behind the stomach here and runs toward the spleen. If you're going to do a Whipple operation, what happens is this entire region needs to be removed. And because of the blood supply and the anatomy, typically what that means is part of the stomach, part of the intestine, the pancreas, and the gallbladder, and the bile duct are taken out of this. And so to do that graphically is pretty simple. In the operating room, that just took about 3 or 4 hours. But now the problem is we have to get the bile ducts back together because they're sitting here, cut. We have the pancreas that's been cut. And we have the stomach, or many times the duodenum is left behind. So this stomach comes down, and there's a hole here for the duodenum. So this is our liver, these are our bile ducts, this is the stomach, the pancreas is behind the stomach, spleen is still intact, and we've cut the bowel. So now what we're going to do is take the bowel and move it up and sew it to the pancreas, the bile duct, and the stomach. So, I'm not a great artist, but what happens is, simplistically make this pancreas stick out a little bit. We're going to sew the bowel to the pancreas. We're going to sew the bile duct to the bowel. And now we're left with this stomach, and let's pretend there's a hole down here. And so then we'll weave this thing back. And so now when the patient eats, the food comes down the esophagus, it goes to the stomach, goes to the intestine, and the body's smart enough to send it downstream. The pancreatic juice coming from the pancreas here drips in and heads downstream, as does the bile from the liver. So this is a pancreaticoduodenectomy, a hepaticoduodenectomy. That means the bile duct of the liver are sewn together, as well as the stomach or the duodenum into the intestine. So 3 different anastomoses. Very complex operation, can take between 3 and 6 or 7 hours. But it's an important operation for people to understand that have a mass in the head of the pancreas, tumors in the pancreas, or sometimes the bile duct or the duodenum. This is the Whipple operation.